This presentation is one of the State of Iowa Employee Benefit Highlights series. This presentation will review 4 key health insurance terms. Understanding how they work will help you better understand how your State of Iowa health insurance works and how much you will pay. The first term is copay. A copay is a set dollar amount you pay for doctor's visits, prescriptions, and other healthcare services. The copay amounts vary for prescription drugs by what formulary tier the drug is located in. Copays don't count toward your deductible, but they count toward your out-of-pocket maximum. Let's look at 2 examples of copays. The first example is an office visit with your primary care provider, or PCP. Both the Iowa Choice and National Choice health options have a $15 copay for the visit. The full charge for the office visit is $150. You pay the $15 copay, and insurance pays $135. The second example is a prescription drug copay. You have a prescription drug which is located on Tier 3 of the drug plan's formulary. Because the drug is on Tier 3, which is a non-preferred brand name, the copay is $50. Since the full cost of the drug is $500, you pay $50 and insurance pays $450. A deductible is the amount you pay each year to cover certain medical expenses before your insurance option starts paying. Both Iowa Choice and National Choice have $250 annual deductible for single coverage and $500 annual deductible for family coverage. Health services requiring a copay do not require you to meet the deductible beforehand. Examples of services requiring you to meet the deductible are inpatient hospital services such as room and board, inpatient physician services, inpatient supplies and inpatient surgery, ambulatory surgical centers, outpatient diagnostic lab or radiology, ambulance transportation, inpatient or outpatient mental health and substance abuse treatment, and outpatient therapy services such as chemotherapy, physical therapy, occupational therapy, respiratory therapy, and speech therapy. In this example, you are admitted to a hospital as an inpatient. Your hospital charge is $7,000. Inpatient services require the deductible to be met before insurance begins to cover the service. The single deductible for Iowa Choice and National Choice is $250. The first $250 of the hospital visit is your responsibility. Based on the plan design, insurance will be applied to the remaining balance of $6,750. When the $500 family deductible has been met by a combination of family members, all family members will be considered to have met the deductible. In this example, while no member of this family has met the single deductible, the family combined has met the $500 deductible for the calendar year. Through the remainder of the year, no family member will have a deductible. Coinsurance is the percentage of cost for a covered healthcare service you pay, 10 or 20% for example, after you've paid your deductible. The Iowa Choice coinsurance is 10%. The National Choice coinsurance is 10% if services are performed by an in-network provider, or 20% if the services are performed by a non-network provider. Returning to our inpatient hospital example. After meeting the deductible of $250, coinsurance is applied to the remaining balance of $6,750. Assuming the hospital is in-network, the coinsurance is 10% or $675. The total cost to the patient is $925, $250 deductible, plus $675 coinsurance. The out-of-pocket maximum is the most money you will pay during a year for coverage. This is a cap on your cost for the year. The out-of-pocket maximum provides you and your family financial protection against large catastrophic medical claims. The out-of-pocket maximum includes deductibles, coinsurance, and copays. Prescription drugs have a different out-of-pocket maximum. The out-of-pocket maximum does not include premiums you pay and services not covered in the state's plan. In this example, Mary has single coverage. The benefit design is the same between Iowa Choice and National Choice. During the year, Mary visits her primary care provider or PCP for treatment of strep throat. The office visit is a $15 copay, so $15 goes toward the medical out-of-pocket maximum. Later in the year, she has an MRI due to back pain. The cost of the MRI is $1,600. Her portion is $250 deductible plus 10% coinsurance for a total of $385. Now she has $400 toward the medical out-of-pocket maximum. Mary then breaks her ankle and spends the night in the hospital. The inpatient hospital stay totals $7,000. She has already met the annual deductible of $250 and the coinsurance is 10%. 10% of $7,000 is $700, but Mary only has to pay $600 because she has met her medical out-of-pocket of $1,000. The crutches for her broken ankle and any other medical expenses for the remainder of the year are at no charge to Mary since she met her out-of-pocket maximum. Note that Mary has a monthly prescription for high blood pressure. Because there is a separate out-of-pocket maximum for prescription drugs, Mary will continue to pay her $15 pharmacy copay for this prescription monthly. General information about these health insurance terms can be found on the DAS Benefits Health Insurance webpage. The site contains 4 well-marked YouTube videos on copays, deductibles, coinsurance, and out-of-pocket maximums. If you have additional questions about your employee benefits, contact your agency's Human Resources Associate or send an email to employee.benefits@iowa.gov. Thank you for taking time to learn about the state of Iowa benefits.